Hi, today's episode will discuss more about cesarean section and vaginal delivery. We'll try to tell you about the pros and cons of each. We are not talking about cesarean section vs vaginal deliveries, which is better or which is worse. Now, every day in the media, you'll read that the rise of cesarean section rate in Kolkata or in our country. Now, when as a doctor I read into it, I feel very bad, and we think that we are not doing enough to inform the lady which is the best way. So I feel very motivated to come in the clinic. And then I talk with my patient about the mode of delivery. The first thing they will say, doctor, I want a C-section. So in today's day, the woman has every power to choose which way she wants to deliver. Now, if someone has a vaginal delivery and the delivery goes smoothly and safely, she will have a very good recovery and she will have a healthy baby. Now, if she opts for an elective cesarean section, again, she will have a healthy baby and have a good recovery. So, the message is that if you have a vaginal delivery which is going very well, or if you have a C-section which is planned, you will have a healthy baby and you will recover well. But if we consider a vaginal delivery that goes safely with a cesarean section which is planned, I have to say that a vaginal delivery is much safer or better for the woman and the child than a cesarean section. Now, if a couple comes to me in my clinic and asks, Doc, we want a C-section, what I do? Now, I tell them, be honest about your concerns and about your feelings, why you want a cesarean section. And then we try to clear all their doubts, give them all the information about the safety of vaginal delivery or the risk of cesarean sections either way, because both of the procedures can have its own complications, and give the woman an informed choice what really she wants to do. And so what we ask that why you want a cesarean sections, what are your concerns? Now, sometimes if they're a first-time mother, they are worried about the vaginal delivery because of the pain, one of the reasons, because of the unpredictability. They don't know what exactly to expect if they go into labor. Now, if you talk to your doctor, if we tell you, explain you what is vaginal delivery, how it happens, what are the options of pain relief you have, because nowadays we have epidurals where the labor will be painless, you can move around during labor. Now, what supports we can give you, like you can have one-to-one midwife care in Pagratinaotia, you can have a partner with you. So if you know all these things which will relieve your stress, sometimes definitely you change your mind and you go into for a normal delivery or normal vaginal delivery. Sometimes you are more concerned that if I have a vaginal delivery, I may have a urinary incontinence because you have heard from your friends. Now in that case, there is an increased chance of pelvic floor damage if you have a vaginal delivery, but the chances are very low. Another reason which we find that a patient comes to us and say we want cesarean sections because they don't want anything unpredictable, because the very type A personality, they want everything to be planned. This day I'll have a baby, this day I'll go home, this is how I will start my gym. That's what they think. Now in that case, what we say, vaginal delivery is very unpredictable. You don't know when you go into labor. Now, we can do elective cesarean sections in that case, but you must know there is another option. You can have your labor induced when the baby is mature, and your doctor can tell you about the induction procedure and the risk and safety of it. So sometimes I say, my husband lives abroad and he wants to come during only this time, easily for 2 or 3 weeks, and you have to have a labor. It doesn't mean that you have to have a cesarean section during that time. Jolly well you can go into inductions because it takes 2 to 3 days for a delivery. At the same time, I want to highlight one thing, that sometimes we get requests from the patients or mostly from their in-laws and family members that we want to have this baby in this date because my pandit has given mahara. One thing that don't try to push us too much, because sometimes it becomes very unsafe, because there is something called iatrogenic prematurity of the baby. If you tell us and give us a date, I want the baby to be delivered during this day, and maybe the baby is not mature enough, and you have all the right to deny, because at the end of the day it is your safety, it is your baby's safety. Okay. Sometimes you want to have a cesarean section because you have a very bad experience of vaginal delivery in the past. Now let me tell you, every delivery is different. Something went wrong in your past vaginal delivery doesn't mean that the same problem will arise this time. So if you have a bad experience, talk to your doctor. We'll try to find out what went wrong, what we can do to change that thing this time, and jolly well you can have a cesarean vaginal delivery. This time it should be much safer and will give you a much better experience. Now we always want to give women an informed choice what they really want to do, and we'll discuss in details about the pros and cons of vaginal delivery and a cesarean section. Now, if we take vaginal delivery at the beginning, now what are the pros and cons of a natural birth? Now, if you have a normal vaginal delivery, your hospital stay is much shorter and you recover much more quickly. And if you have a very good successful vaginal delivery, the woman feels a source of empowerment, a source of accomplishment, that they feel that I have achieved something, and it's very important experience in your life. Now, the risk of problems like asthma, lactose intolerance, all these allergy things in the baby is much less if you have a vaginal delivery. If you go into labor and have a successful birth, next time if you have a vaginal delivery, it will be much more quicker than your first time and will be much less complicated. You can breastfeed your baby much more quickly if you have a vaginal birth, and the bonding between the mother and the baby will establish much faster. But now there can be some cons of vaginal delivery because everything is not absolutely safe or absolutely brilliant. Now, vaginal delivery, as I mentioned before, can be unpredictable. You don't know when you will go into labor, and there can be some unforeseen complications. You can start bleeding during the procedure. The pain relief which you are having, like the epidural, may not work properly, or your labor can be very slow. In that case, we have to do some assisted vaginal delivery. We'll come into later about that. The baby can have some trauma if you go into labor and suppose your baby is very big. Sometimes you have something called a shoulder dystocia, where the baby's head comes out and the body gets stuck, and when we try to deliver the baby, there can be some injury to the baby. So this risk is there, and you have to go take that risk if you want vaginal delivery. As I mentioned now, the assisted delivery, what happens now? If your labor goes a bit slowly in the second stage, when you're giving the active pushing, and we see that the baby is slightly disturbed, the heart rate is going up and down when we see the CTG trace. In that case, we either give a forceps or ventouse, that means a cup is fitted in the baby's head, and we try to deliver the baby much more quickly with your help. Now, if we give forceps or ventouse, it will slightly increase risk of trauma to the baby, or there is slightly increased risk of incontinence or pelvic floor damage. So we have to deal with that. And sometimes during vaginal delivery, we give a small cut in the vagina, which is called episiotomy. And it's usually very small, but sometimes the cut may get extended, or there can be infection in that cut. So these are very simple things, and most of the time it doesn't happen. But again, as I say, that we have to give you an informed choice. So if you want to go for a vaginal delivery, you must know that these things may happen, or there is a possibility for this to happen. So enough of information, and I don't want to make you more confused, so we'll come to an end. So the hallmark of today's labor management is that the woman has the right to choose what she wants. If you want to go for a cesarean section, elective cesarean section, if you know all the informations, if you want that, we'll do it. If you want to go for a vaginal delivery, we'll help you to go through a normal vaginal delivery that ends well. If there is any complications, we'll stop that and we'll go for an emergency cesarean section. Because at the end of the day, we want to have a healthy mother and a healthy baby.